would you believe a patient would have 74 touch points from entering a hospital to exiting a hospital while they are being admitted in the hospital ecosystem?
Right.
You will interface the security, the parkings, the admin, the admission process, the front office, the billing, the estimation of your expenses, the insurance, the TPA, the doctors, the nurses, the paramedics, the transport guys within the hospital. One of the most complex ecosystem.
True. In terms of government hospital, do you think something shifted from then to now?
While it's a government hospital, there is no services facility.
Right.
That is where I would say I thought the healthcare has to be better.
True.
Apollo is one of the most trusted healthcare organization there for more than 4 decades. I've been part of the hospital and the digital ecosystem. So I've seen Apollo from an inward out and outward in point of view while I've been part of the competition also. Right. A beautiful organization. You should understand the healthcare space, the illness space and the wellness space.
Wellness space. Okay, you put it very well.
Yeah.
Welcome back to Beyond the Title, a podcast where we go beyond job descriptions, designations, and achievements to uncover the people behind them. On today's episode of Beyond the Title, we are joined by someone whose journey spans medicine, healthcare innovation, large-scale impact, and leadership. While many doctors dedicate their lives to treating patients one at a time, our today's guest is someone who has spent years of his life trying to build and shape healthcare systems that touch millions of lives. Today, we're joined by the Chief Medical Operations Officer at Apollo Hospitals, Dr. Lalit Kanodia. Welcome, sir. Welcome to Beyond the Title. We're so glad you're here today. So, everybody knows you as a healthcare professional. So, I'd like to start off by knowing who you are beyond your title.
Okay. I'm essentially a boy from a small town, right, who loves to, explore, travel, a cricket enthusiast.
Oh, nice.
Right. So that's what defines me to a greater extent beyond my healthcare, title.
Okay. Awesome. When people hear the word doctor, they usually associate it with a white coat and a clinic. So when did your journey start beyond the setup?
So my journey has been quite interesting. I've never been a kind of a doctor from a beginning.
Right.
My father owned a chemist shop, and I used to help him out during the lunch hours. I used to visit the shop on and off during my summer breaks and all those stuff. So I was destined to take over my father's shop, and that's how my journey with healthcare started.
Okay.
To an extent, it was class 7th when I started to, help him out in his shop. Right.
Okay.
I was doing inventories during my summer breaks, and session breaks.
Right.
So by class 11th, 12th, in fact, I was familiar with the medicine names to a greater extent.
Wow. Okay.
Right. But something happened in 11th standard, when everybody was preparing for the medical stuff. I was looking more towards getting into the pharmacy technical domain, and that's the reason I took biology.
Okay.
Right. But fortune turned. I just took the pre-medical entrance exam casually.
Right.
And I did score.
Wow.
And then we decided, let's go for it.
Okay.
So that's where the healthcare journey started. I did my MBBS. MD also I was able to crack at the first attempt.
Right.
And immediately after doing my MD, I was able to crack a job in the corporate.
How? I'm sure it's not an easy journey, especially in medicine.
So again, that's a very interesting turnaround, I would say. While I was doing my MBBS, so I was quite fascinated by the medicine. Right. So the peers and colleagues near me said, okay, you'll be a good clinician. You'll ought to go into MD medicine stuff. While I was doing internship, when you get exposed to patients and all those stuff, I was reading a lot about the pharmacology and the research, the pharma companies' research and the drug research which is going around.
Right.
And that kind of attracted me to some extent. And during my MD, I took a conscious call of taking pharmacology as a my post-graduation while I was getting anesthesia, skin and other branches also.
Right.
So rather than picking up a clinical domain, I went to a quasi-clinical domain. And that's where I started my MD Pharma.
Okay.
Towards the end of the post-graduation, the Indian pharma market, especially the research one, was being turbulent.
Okay.
Guinea pig syndrome, if you have heard of, right? Those things were emerging. While I was coming out, I had a couple of options. I interviewed one pharma companies for a principal investigator into a drug research company. And then I also landed up with Apollo Hospitals. That was
Right.
my first job as a clinical pharmacologist.
Okay.
That was to review the medications being provided to the patients.
Okay.
I thought, why not to get into that domain
Yeah.
while the other domain is slightly struggling. And Apollo also has a research wing. Maybe I'll find out a way to navigate.
Eventually. Right.
Right. So that's how the journey started. And then
Okay.
we'll talk further about the journey. It's been very interesting one.
Right. So, what kind of child were you growing up?
Very shy.
Yeah. Okay.
I was very hesitant, very shy, to an extent. Even if some, even family members will come across in the, in a house for a, meet and greet, I would
Right.
hide about behind my parents.
Oh
So
no.
that kind of a child I was. But at
Okay.
the same time, I was very, very sports enthusiast. I would go out to play, and that was my social network,
Right.
right? But somehow those two traits kind of coincided.
What initially inspired you to take your medicine beyond uh, your father being a chemist, having a chemist job? Or
There's
was it,
no
the fear of maths that,
In fact, I had biology and maths both.
Oh, wow.
In my 11th and 12th standard, I have
Okay.
both, right?
Okay.
And I did appeared for the engineering entrance also,
Okay.
but the primary focus was medical,
Medicine. Okay.
and inspiration was purely my father's,
Right.
entrepreneurship. So when I did see a lot of patients coming across in pain, I was, helping him out in his shop.
Right.
So I interfaced patients a lot, and our shop was in front of the government hospital, right? So you understand, government hospital is a very, very different healthcare facility.
True.
You will have patients from not so socioeconomic
Right.
good background. You will have patients who are struggling for finances. You will have patients struggling for high-end diseases also.
Right.
And because we were right in front of the emergency department, and father had good connects with the doctors, so I knew few doctors, and they
Right.
would come to my father's shop. We would have discussions. I'll just hear them out, and in between I also visited hospital,
Okay.
right? When I did look at patient stories, when I looked at the kind of healthcare facility we are
Right.
associated with,
Right.
it had an inspiration. It was a calling,
Right. Exactly.
when it happened. But yes, that's where I would say the calling started.
Was there any particular defining story for you, or any patient story that you came across that made you feel like
Yeah,
you could actually create an impact in this field?
it was, and it's a bit of painful story, I would say. And it's story of one of our neighbors.
Oh.
In the middle of night, almost at 11:30 p.m., my father got a call. My one of our neighbors, they got an accident from a train, and
Okay.
they've been admitted into the government hospital. They need some medication support immediately.
Right.
My father had a night blindness issue, so I used to
Okay.
help him out and navigate the
Right.
scooty, right? So we took along, opened the shop. While it's a government hospital, there is no services facility.
Right.
So we took all the medicines required for him in a
Right.
bag into the hospital, and in the hospital, outside the operation theater, I could see this guy limb amputated
Oh my God.
from the door
Oh no.
and struggling for to get the medicines for his life-saving scenario. That is where I would say,
Yeah.
I thought ki, the healthcare has to be better.
True.
The services has to be more patient friendly. Nobody has to call their connects and find out who can help me with the medicines, who can help me get it delivered inside an OT, right?
Exactly.
So
Yeah. Do you
those
think
kind of,
something shifted from then to now in terms of government hospitals?
it has. So my MBBS and MD both has been in a government hospital facility. Though government hospital also have their different status and
True,
categories,
true.
right? It was a small town tier 2 setup,
Right.
right? So
Oh,
yeah,
where was this
facility.
we
It
talking
is
about?
Bhiwani. It's my
Okay.
hometown,
Right, right.
right? Uh, while I graduated from the medical colleges, so basically
Right.
mainstream cities, Bikaner I did my MBBS, Dibrugarh did my MD.
Right.
So yes, the infrastructure wise, the government has a lot of spend on the healthcare facilities, and it has improved in the recent past, especially after COVID, when people have realized the importance of
Exactly.
having a good infrastructure.
Right.
But digital automation, services front, even to an extent hygiene, that is
That's a
something
really,
has to
yeah.
has to improve a lot.
Right. What was the first moment that made you realize healthcare is more than just treating patients?
So as I said, well, I was in my MBBS times, I was doing my internship. I so Bikaner has a very interesting facility where I did my MBBS. It's a dedicated unit for cancer patients,
Okay.
right? And cancer is one of the area where the researches happen a lot,
True.
right? Because new treatment regimen and everything, comes across. When I was doing my intern in that particular facility, I could see a lot of experimental drugs were being used in patients who were not being able to be treated by the traditional therapies or traditional regimen. I would say traditional means
Yeah,
the first line
conventional.
therapy,
Yeah.
not the traditional
Yeah, yeah.
therapies, right? And there where I could figure out it's a lot of scope in terms of a drug research and evolution.
Okay.
Right. That was my first again experience of figuring out it's just not looking at patient, assessing the patient, giving the prescription,
Right.
doing the surgeries, all the stuff.
Right.
A big part of healthcare also requires a new drug development to happen, and that's the reason the MD Pharma
Right.
kind of
Okay.
strike.
Okay. Who would you say was your mentor when you first started out?
So life has been full of mentor.
Oh, yes.
Before starting my MBBS journey, definitely my father has
Father.
been my
Right.
mentor to a greater extent. As I told you, I was very shy. What he did basically, he made me run around for his shop related activities. So I will do,
Okay.
as I said, so there were 3, 4 staff who were in the shop helping father. He would not treat me differently,
Okay.
right? There was a daily routine of going to a shelf, cleaning it out, wiping it out with a cloth, arranging the medicines, looking at the expiry quantities and all those
Yeah.
things. I'll do the same thing as the staff would do.
Okay.
He will also make me go visit the market, take orders, take payments, collect
Right.
payments along with the staff.
Yeah.
Right, I was a kid that time, but yes, to make sure
You receive good training.
yeah,
Yeah.
so that personality development can happen. How to
True.
interact in the market, what kind of people do you interface
Yeah.
with? So those learnings, I would owe it to my father who
Right.
let me do that kind of an exposure very early on. While I was doing my MD, our HOD was amazing person, right? She would do things so differently to make sure you learn the stuff,
Right.
right? So the moment you go with some kind of a proposal, okay, ma'am, we know because it's a MD Pharma, it's a
Right.
research-oriented program,
True.
be it publication or conducting a research. So in fact, for my own research, as a thesis which I published, we got a new spectrophotometer installed in the department, which is almost worth 75 lakhs. And she
Oh
took
wow.
the, Herculean amount of pain to get a budget approved and
Okay.
to make college
Right.
uh, maybe in a direction to say, boss, this maybe require future research, not
Right.
only this guy. So those kind of people I always had my mentors for. Then when I landed in Apollo Hospitals, my first job, my first manager, a great manager, great
Right.
mentor, I would say. From him, I learned a lot
Yeah.
in terms of leadership capabilities. How do you manage your team? How to be empathetic while making sure the work is being done.
Right.
So yes,
Lot of mentors.
lot of mentors, and I
Yeah.
still keep on getting mentors.
Lovely. Lovely. So, what did success mean to you when you first started this journey in medicine?
See, definition of success changes over
Keeps
time.
changing. Yeah.
So success is never constant, and success is also perishable.
True. True.
You need to really do consistent effort to ensure you are successful every time, every now
True.
and then. So success to me at the end of the day, if whatever you are doing, you are happy with it.
Right.
If you have inner peace and happiness, if you come out of your work schedule,
Right.
you feel happy about it, what you did today, it's success.
Success. Right.
The rest everything is notional.
Yeah. Most doctors focus on clinical practice. So, what made you gravitate towards leadership, operations?
I would say it's more destiny than
Okay.
actually gravitating towards. I got pulled up into the gravity of it, I would say.
Right.
When I started, as I said, as a clinical pharmacologist, so my job was essentially to do the clinical quality management and do the clinical audits of the patient records to ensure if there is any error. If that
Right.
is there, I need to talk to the clinician, get it corrected so that no patient is getting harmed. That
Right.
was my first job
Job.
description, would say.
Right.
But I was part of the Apollo's pharmacy ecosystem, right? So, and because of my mentor, as I said first,
Right.
right, he also gave me access to the operational elements of the pharmacy.
Must be a great exposure.
Exactly. So, in the first job itself,
Right.
actually I had a matrix reporting to three different CEOs.
Oh, wow.
Right, I was reporting to my pharmacy CEO for the pharmacy stuff. I was working with the hospital's, facility director for the clinical audits and everything else, and the hospital
Right.
quality management. And I also got the research part. So I
Okay.
was the trial site head for the, one of the hospital site clinical
Wow.
trial, and reporting to the clinical trial CEO.
It must have come with a lot of responsibilities too.
It is, and it's not
It's a
easy.
very
It's not
exactly.
easy.
How did you balance all?
See, essentially, you just need to make sure to let your bosses know their work is getting done, what they
Right.
expect out of it.
Right.
The KRAs are defined,
Mm-hmm.
and you have a quantifiable way to measure and showcase
Right.
how things are being done.
Right.
So if it that is clear, articulated, documented, things gets better.
So, if not for your career being in operations and leadership, did you ever envision yourself actually practicing medicine?
I have kept it just for the retirement for now.
Right.
But yes, I keep on doing peer practice, as I call it.
Mm-hmm.
A lot of people do come across with who require guidance.
Okay.
So I try to be more of a layman communicator, because healthcare is a very technical terminology,
True.
right?
True.
A lot of people do not understand what the investigation says, what the prescription
Right.
says, beyond the handwriting of the doctor,
True. Oh
right?
yes.
Right. So that is where I try to help my peer colleagues, friends, circles, society to a greater extent, to let them decipher what it means to have this disease for them,
Oh
what
right.
could be the treatment options, what the right specialist to go for,
Mm-hmm.
and if there is any you know input I give them in their keeping in healthy, what kind of medications they can do,
Right.
specifically how to take, how not to take medications. So
True.
that is
True.
something people really must understand, so that they get best out of the medication, the treatment they're getting for. So
Right.
that's what I keep on doing,
Okay.
and it get actually amplified a lot during the COVID times.
Hmm.
So I'm happy I was able to help a lot of people around in terms of not only accessing healthcare facility, but also managing their own situation
Right.
at home or something.
What skills that you've learned from medical school unknowingly or unexpectedly helped you a lot in your journey?
See, medical school, uh, like any other school, not only teaches you what you are learning as a medical practice,
Right.
right? It's also a social network,
Right.
right? I was fortunate enough to have a good friend circle, good social circle, and I had a bug,
Okay.
which is going to the hospitals and duties after our college time. So
Mm.
what I used to do after our classes are done, I
Right.
had good friends or mentors with my PG seniors,
Mm-hmm.
right, who were practicing in the wards. I used to go to the
Okay.
wards, do simple processes like injecting,
Okay.
dressing,
Nice.
monitoring, doing
Right.
investigations. So those all things, skills I learned a lot from a very practical point of view, rather than just reading the books.
Got it.
So while doing this, I was also being interacting with a lot of society and strata, because again, as I said, it's a medical college,
Right.
and people were coming from different areas, be it Bikaner or Dibrugarh. So I really met interesting people.
That's nice. Good circle, good
Good
social
circle.
circle.
See, circle is something you keep it with you. It's not something I keep it with me. I
True.
keep the memories with me,
All right.
not the people. I remember I met a astonishing astrologer
Oh,
who was
okay.
having a renal failure, as being treated.
Right.
I met tech innovator also,
Hmm.
whose vision was 15 years back around AI,
Oh, okay.
right? While AI is not even a buzzword
True,
that
true.
time. So this is something you get to learn from people. Okay, what is the future around different aspects of the professional domains, not just
True,
healthcare.
true. You said you were a shy kid, so when did this transition happen?
So I owe to my father,
Yeah.
So one, my father, and second, my sister. She was very peculiar and particular. You have to be in a hostel. You
Yeah.
have to learn the hostel life.
True.
That's where all those things will go away. So early 11th, 12th times, father made me to run around in the market for all
Okay.
those
Yeah,
things.
yeah.
And then when I actually entered my college life, being into a hospital facility, I think it took me 3-4 months to adjust to it.
Mm-hmm.
But that is where it gave me that confidence, took
Yeah.
away my shyness, hesitation of sorts,
Right.
and I think everybody must experience that.
True, true. Hostel life personally changed me a lot. For the first time got out of my comfort zone, and
It
I'm a
does.
whole different person now, like
It
compared to
happens.
what I was
It
before.
happens. It happens.
Yeah,
It transforms you to a
exactly.
greater extent, I would say.
Which department of medicine excited you a lot?
No, as I said, again, I took consciously the pharmacology, right? And that's the reason I took my, went into the MD. While I was into the early parts of my MBBS, medicine was the one which, I was practicing,
Right,
reading, learning a lot, as I said, doing the ward
right.
rounds and everything else. While doing the internship, I got little excited about the drug research, right? And that's the reason, in spite of not so good rank in my PG, I consciously took the
Right.
MD pharmacology and went into drug research,
Right.
and destiny changes.
Yeah. Being in a field like medicine or in your healthcare domain, you need to constantly keep updating yourself with the market trends and
Correct.
what's actually happening out there, different countries, and how do you keep yourself up to date with that?
So a reason for this change evolvement is also my wife. I
Okay.
will owe to her,
Right.
and I'll just explain it why. So I started as a clinical pharmacologist in the Apollo Hospitals group, right? And when I started looking at, okay, I'm getting into pharmacy administrative services, supply chain management. So she pushed me, okay, we should go for an MBA. So
Yeah.
a couple of years later down the line, I did an executive MBA.
Right.
Then so I got a chance to work in a startup. That was a whole different experience.
True. True.
In startup, you do things differently, agile, super fast,
Yeah.
so all those stuff were there. Then, we thought, okay, yeah, we need to learn the process excellence, if you really need to succeed in these kind of
True.
ecosystem. And again, my wife was the one who picked up, okay, let's do Six Sigma. And I
Oh,
gradually
nice.
did the Six Sigma black belt.
Right.
While I was in KPMG, we realized, P&L understanding, financial understanding,
Right.
strategic understanding is must.
Right.
So again, she found out a course for me from INSEAD,
Wow.
and I did a business strategy course from INSEAD just to keep on my learning curve ahead. Then you work in health tech domain, and the AI movement started way back in 2022 when the bubble started to
True.
rise. So we thought something we need to do about that. So we figured out a course with ISB on leadership with AI.
Right.
So that is something I did couple of last year, I guess, last year.
Okay.
So the
So
thing
it,
is, you tend to find out what's relevant in the coming time and figure out the best relevant interactive module for you, which gives you hands-on.
right.
And that's how you try to
So
gain
your
ahead of the
wife
learning
has
curve.
been a driving force
Yes,
throughout.
absolutely, absolutely. She keeps on hunting and searching for me, and even now, that's something she is figuring out. Because
Lovely.
at once you have reached a C level, the next is, how do you look at the board level?
True. True.
To be a board competitive person, you need to understand the board, companies of registrars. So actually, I'm doing a course right now and trying to look at, as an independent director, what is it requires to me.
Okay. Oh wow. What is it about? Like.
So it's about understanding the board ecosystem, understanding if you are on the directorship panel of any company as an independent director,
Right.
what it takes, what all skills you must have,
Right.
and be ready for that once the opportunity strikes.
Okay.
So that's the
All the
process I'm
best
doing.
with
Thank
that.
you.
Yeah. Yeah. What are the kind of leadership skills that you only get to learn in hospitals or the healthcare domain?
So healthcare is one of the most complex
Right.
ecosystem, I would say. There is no one-to-one,
True.
right? Would you believe a patient would have at least 74 touch points from entering a hospital to exiting a hospital while they are being admitted in the hospital ecosystem?
Right.
You will interface the security, the parkings, the admin, the admission process, the front office, the billing, the
Right.
estimation of your, expenses, the insurance, the TPA,
Oh my
the
God.
doctors, the nurses, the, paramedics, the
Right.
transport guys within the hospital,
Yeah.
one of the most complex ecosystem.
True.
And if you talk about leadership, process excellence, the complex system gives you the higher understanding of how deeper you can get into a process, right? That's what I believe the healthcare gives you access to.
Okay.
And I just talked about a simple operational flow.
Right.
There are HR, finance, strategy,
My God.
business, development,
Very
and all those things
strenuous.
are,
Yeah.
there, which is all associated with the healthcare, including marketing, branding, everything,
Right.
right? So it just not only give you the traditional business outlook, it also gives you a very deep dive into a complex ecosystem, and that too sensitive because it's a life
Yeah.
decision you actually
Right.
come across.
Yeah.
Whatever you do is going to directly impact one's life,
True.
right? So you have to be careful.
Yeah.
And the last and the most important part is it's a highly regulated sector.
Oh,
You
yes.
can't do anything
Anything.
which goes
True.
beyond the
Right.
law of the land, right?
Yeah.
So if you have to interject the regulatory landscape, the financial, the operational, and the strategy book, it's the healthcare you actually
Oh,
want to work for.
yes. What's that one decision that you made in your career completely changed your trajectory?
Okay. So actually opting for a startup job is something I would really hold in high regards.
Right.
While I was in hospital, I was learning a lot. Almost 10 years straight down the line from my Apollo to Vedanta journey, I was through and through in the hospital journey. But the moment I opted for a startup job and that too in a leadership position, that gave me wings.
Mm.
That gave me exposure to how rapidly the world can evolve.
Right.
And to evolve with the world, you really have to evolve faster.
True.
Startup में एक बहुत simple story है. You have to run faster than the others,
Mm.
right?
Yeah.
And it's not only run faster, you also have to run better.
How was the adjustment though? You come.
It comes with
Exactly.
a lot of price and understanding,
True.
right? So it's all about mindset, I guess.
Yeah.
Adjustment is nothing. It's a physical or something. It's all emotional adjustments. It's all once you are ready for the job, you understand what you are supposed to do. You
Yeah.
understand what is the expected outcomes from you.
True.
You can deliver. There's nobody who can't. Uh,
Yeah.
it's not about skills. It's all about your
Your
mindset.
mindset. Which environment did you thrive in the most?
So it has to be challenging.
Okay.
Right,
Yeah.
startup or not, startup is one by design, it is challenging.
Challenging.
But
Right.
even mature startups, they do get into the domains of you know uh, lacklustersness, but it has to be challenging. My
Right.
only thing is I can't do same thing over and over for
Right.
years.
Right.
It has to get into new different domains. Right now I'm looking certain strategic decisions for the insurance sector within the healthcare startup ecosystem or health tech startup ecosystem.
Okay.
So something new you have to do.
Has to keep
Otherwise,
doing.
it doesn't
Life is
fit my
very
appetite.
monotonous. Yeah. So you've been a part of bigger, larger ecosystems, healthcare ecosystems like Apollo, Tata 1MG, and all. So what excites you much more, like for transforming all these systems in healthcare?
See, again, if you are able to do something meaningful for the larger community and at the same time have a business model which is sustainable,
Right.
right? So you do things right
Right.
for the community. At the same time, you do things right for the organization.
Right.
It sets you right,
True.
right? So what I really look forward to look into those new when the digital transformation is happening, the
Exactly.
ways of looking at the healthcare ecosystem be delivered in much scalable and sustainable ways.
Right.
So those are the things, few of the projects we actually have picked up.
Right.
While one of my core competencies and the job requirement is to ensure clinical governance,
Mm-hmm.
right? When I say clinical governance, there are two words, clinical
Right.
and governance. So it has
Right.
an overlap with the regulatory governance as well as
Right.
the clinical mindset. So see again, uh, you go to a medical shop, you can just buy an antibiotic
True.
without a prescription.
Right.
Not the right way to do.
During the rise of this healthcare evolution, so what opportunities did you see like long before that could actually be very beneficial currently?
See again, as I said, it's a very complex ecosystem. So while the traditional nursing, doctors, pharmacy, paramedics will keep on rising because
Right.
of the increasing healthcare needs,
Right.
I try to be little unorthodox,
Okay.
and that's the reason I've been in this domain.
Right.
So if you look at experts from health tech domain,
Mm-hmm.
so that is one very opportunistic area
Right.
which is evolving very fast.
Right.
Second is And this health tech is a convergence of two domains. One is from the technology domain coming to a
Yeah.
health ecosystem, and then healthcare domain coming to a technology ecosystem.
Okay.
So that merger, I believe, is something very interesting and would evolve further.
Yeah. If you could redesign one aspect of India's healthcare tomorrow, what would it be?
I guess India's healthcare, and to a larger extent, it's also there in some Western countries. It's so health and wellness has two components, as we say, health and wellness.
Right.
One is called as curative, one is called as preventive.
Preventative. Right.
Right now, the focus is on curative
Curative.
aspect.
Right.
The moment we shift our focus to a preventive aspect, right, there is the frame shift change, right? People don't proactively do the wellness part of it.
Right.
Why to get treated after a disease has incurred? Why can't the disease be prevented before
Prevented.
the disease is incurred?
How long do you think it's going to take to bridge this gap?
Decades, decades,
Decades.
decades. While if you see in the specifically in the startup ecosystem, a lot of organizations has evolved into the wellness space.
Mm-hmm.
But this wellness space is still more maybe corporate ecosystem driven, where
Right.
companies do offer something. It's not true wellness.
Mm-hmm.
There has been some organization in the West, not in India, they have tried, who incentivize users to be healthy. Their
Okay.
insurance premium would be less, their
Oh,
healthcare
yeah.
spend would be less,
Less.
they get
Right.
better credits to spend on their healthcare needs and all those things. So I think that kind of, so right now, there is a self motivation to wellness. There is
Right.
no incentivation or a motivation which come across by your actions and deeds,
True.
right? If you are motivated, you'll do. But if you're not, maybe you're not forced to get motivated.
Right.
So something of that sort has to come out.
How could you actually create at least a small impact in a space which is as subjective and personal as well-being and wellness?
See, I would say look beyond. So look beyond means, you carry one core expertise of yours, right? You may be a healthcare service provider. You may be a finance guy working in a healthcare domain. You may be
True.
HR guy working in that particular domain. So there are different, technical aspects who
Right.
come together to deliver the healthcare for a patient or for a healthcare service provider itself,
Right.
right? Looking beyond means when you are into healthcare space, you need to be the flag bearer of wellness ecosystem,
Exactly.
right?
Right.
If you do it yourself, people would follow, right?
True.
That is something I would urge everyone to take care of it.
Okay. What does a day in your life look like now?
My typical routine, I'm a early
Bird?
early bird guy, trying to be most of the days, except
Okay.
the weekends,
Yeah.
right? But
Yeah.
yes, I'm an early bird. I start my early routine, do some stretching workout, physical workout. As I said, wellness is a core
True.
component. Get to the freshen up stuff, and I do visit temple before having my breakfast and all.
Right.
Try to be early at my workplace, because the moment your meetings and daily routine starts,
Right.
you get into a cyclic loop of meetings,
Right.
interactions, and there is not enough time to even you know maybe restore,
True.
right?
True.
So early office going is to make sure whatever I have to plan my day. I just
Right.
make a note to do's for today, which I
Right.
need to complete by end of the day. I do list them down, any dependencies, any emails or communications or something like that. I complete that before my meeting schedule starts. Once it starts, so it's a rapid fire.
True. True.
By end of the day, I try to make sure I go visit my task list again. Anything pending, I just try to finish it ASAP.
Right.
Anything which is spilling over, I need to make sure it gets into the notes.
Right.
And it might sometimes take some long hours, or sometimes it might finish early, but I try to finish my work and move from the office. Don't want to carry my office to
Of course.
my home.
Yeah. That's how it should be, I
Yeah.
believe. So, what are your current responsibilities, or what all do you do currently in your job at Apollo?
So again, as I said, it's keep on evolving, and health
Right.
tech ecosystem is that way. But broadly, I'm looking into clinical governance in the health tech ecosystem. I'm looking into some strategic projects, right, which are ever evolving. New projects keep on coming. So it's more about thinking aloud, finding out the right project schema, do a program management, operationalization, and execution.
Right. So, beyond work, what brings you the most joy?
As I said, I still a cricket fancy guy.
Okay, right.
Not only watching, even playing. I have a weekly schedule of my,
Oh, lovely.
cricket uh, society team is there where I'm actively a part of. I'll try to do some kind of sports engagement, and also one thing I love is intermittent breaks.
Mhm.
Go for a small trip. I'm a
Lovely.
nature lover guy.
Okay.
Really would like to visit places with good nature trails. Yesterday being to Sri Shailam. So on the
Oh,
way,
yeah.
right,
I
so I
heard.
did some nature hopping.
Lovely, lovely. What is something that you're still working on as a person?
As a person or as a skill you're looking at?
As a person,
Okay.
beyond
Yeah.
your profession.
So as a person or as a personality, if I have to,
Mhm.
speak about, I'm still working out to be staying calm even at the most
Okay.
stressful times,
Mm.
because the work nowadays is so, it's
Yes,
such stressful activity, and sometimes you tend to lose it.
true.
So how do you ensure that calmness throughout your work stuff, especially when expected things doesn't turn out? It's not every time you will do something and it will go the way it's supposed to be.
Right,
When it's not going the way it's supposed to be, how do you ensure you recalibrate the stuff very quickly? So that
right.
time delta, because every minute you lose is every productive
True.
minute you actually are losing on your
Right.
stuff. So how do you recalibrate and restart those productive sessions is something I'm trying to work upon.
You've been a part of major healthcare ecosystems. So, what is that one memory or one project that you're glad you were a part of, which transformed the way healthcare system is today?
Okay, that's quite interesting. I really need to think about it. But yes, uh, see what happens in. So I would go back to early days of my professional career. So what happens once a patient is admitted in a hospital, right?
Mm-hmm.
It's being prescribed medications to a greater extent, and there is a process for these medications to be processed within the hospital, get it delivered to the patient bedside, and then administered,
Right.
right? In India, there was never a structured way of oversighting those prescription and administration of the medications.
True.
And if you look at the data on the medication errors,
Mm-hmm.
globally, some, if not a couple of million people die of the medication errors,
Oh
which are
my God.
preventable globally,
Right.
right? And these are preventable.
Mm-hmm.
People are doing, or it gets just done just because people are not skilled or something. It's just an error. Error could
Which can
be error
cost a
of
life.
omission. Yes,
Yeah.
it can cost a life. So, in my early days, we started this prescription audit, departments, which is part of Apollo's DNA,
Okay.
right? While I moved to Medanta, we created this department to a very unique offering.
Mm-hmm.
It's not only who is auditing the complete medication ecosystem from prescription to the dispensation to administration.
Right.
We also did a lot of inventory management within the hospital,
Mm-hmm.
because nurses would have some stock of medicines at the bedside
Right.
in some kind of urgent situations. Patient could severe pain is there, vomiting or fever, they will just take out the medicine from the cupboard and give it to the patient.
Right.
But are these medicine properly secured?
Yeah.
Is there anything which is expired? Is it controlled stable condition they are stored in? So we implemented a clinical pharmacy ecosystem in a way. All those medications which are even at the bedside, patient bedside, and the complete medication process would
Right.
be end-to-end managed by the clinical pharmacist ecosystem, and there would be a custodian at every ward.
It's automated now. That's huge. Must have saved a lot of
It did save a
time.
lot of cost.
Mm-hmm.
It did a lot of processing time. So
Right.
the healthcare delivery to the patient is faster and at the same time safer. So
Right.
that is something I would really take a pride to get and
Of
implemented as a
course.
process for.
Right. How long did it take for you to automate this?
So it took me 3 months to investigate,
Okay.
another 2 to 3 months to implement,
Right.
and automation gradually took over almost 6 months.
Okay. Wow. But still faster it did.
Yeah, within a 1 year, we'll be able to transform, and
Okay.
that's cool, I
What are
would
you
say.
currently working on?
So, if I talk about change, as I said, we are looking at some very strategic insurance products.
Mm-hmm.
You know, we know in the IP space, the patient get admitted to a hospital, they have an insurance cover, and the penetration is,
Right.
still getting better. It's not
Mm-hmm.
100% covered. some 10 years back we were 20% insured population. Now we are
Right.
40. So we
True.
have doubled, but still a long way to go. At the same time, what about our day-to-day expenses?
Mm.
Right, I was just reading some articles, World Economic Forums and all those things.
Mm-hmm.
What they say specifically in Indian data, almost 60% of the outpatient, expenditures are out of the pockets.
Okay.
We have a country with a diverse economic profile. A lot of people have to spend out of pocket, which is more than their regular earnings.
True.
For
True.
that, they have to sell their financial assets to some
Yeah.
certain assets. So, what is that health savings account for them?
Mm.
Is this something as a backup they can create, like an
Right.
insurance which is there when it's required to be used? For
Right.
OPD, which is an incidental expense, how do we do that?
Right.
So we are trying to build that kind of a strategic ecosystem with insurance companies. If you can figure out something in every individual can have as
Right.
a nominal, premium, they
Right.
can have access to a larger,
Larger. Right.
money pool, which can they use as an incidental benefits for their out of the hospital expenses.
Right. So, was there any personal incident that made you focus more on creating a different change?
Not a personal incident. It was more about a reading, and it's an interesting article by I think Niti Aayog. It was being published some time back. It's called as a missing middle.
Okay.
They say 40% of Indian population, which is called as a missing middle,
Mm-hmm.
is that population which are worthy of paying insurance premiums but are not
Mm.
insured for the reason unknown.
Okay.
Right. So
Right.
there is a population which are which is not able to afford the premium. There is a
Premium. Right.
population which is having some kind of insurance. Educate or not is a different question.
Yeah.
But that 40% is not even insured, and they can afford to have an insurance.
Okay.
That is
Okay.
called as a missing middle.
Okay.
So slightly dated article, but it's very interesting one to read about it.
Okay.
So when I read that, I said, that's one a big opportunity for people to have a financial security and a health security.
Right.
Second, for an organization to have a product which is mass,
Right.
scalable, and sustainable.
True. True.
So that's where the idea came across.
Do you believe the advancements in the technology currently can replace the human side of medicine?
See, it will never be able to replace because, as I said, medicine is a uh, very personalized stuff,
Right.
right? Even our textbooks give
True.
you a lot of case scenarios,
Right.
but not every individual will present with either of the cases which is mentioned in a textbook. What technology does is to faster the decision making,
Right.
make it error proof.
Right.
This is what we have been
True.
doing, and assist the healthcare service provider, be it doctor or anybody else, to summarize and bring out that information which is in the textbook codified, which is in the remembrance right now,
Right.
as a front door whenever they are able to provide that kind of information to the patient. Just imagine uh, the patient walks into an OPD, right? Doctors take a note, or even not a take a note. It's just a voice recording which is happening at the back end. The AI is,
Oh,
recording and capturing all the information. Doctor has to create a case summary or a
true.
prescription. That case summary is being automatically,
Done well.
created as the patient and doctor interaction is happening without they being disturbed,
Okay.
right?
Right.
When you go to a healthcare facility, doctor will ask you, they will write or they will type, right?
Right.
That is a crucial time they are kind of, but imagine that's happening as a note taker, which is very
Exactly.
simple time,
Yeah.
right? Now, once it is all done, while there is a final interaction between patient and doctor is happening, the AI also does this with respect to the medical and clinical insights and bring out the complete case history with the potential diagnosis as per the patient requirement, potential
Right.
investigations, which need to be carried forward, potential medications or other therapies which can be given for doctor to review and quickly sign off.
Okay.
One of the hospital we looked at something called as sepsis protocol. Sepsis is a significant serious bloodstream infection,
Okay.
right? And there are certain markers to it, blood markers and all those things, and then symptoms. Every blood investigation is there in the system as a digital report, right?
Right.
The symptoms are daily recorded, right? Based on the symptoms and the markers, what sepsis protocol to be triggered,
Right.
it's at the doctor's end to remember and keep in everything. They might miss something out of it. It's a quite extensive one.
True.
Think of an AI, who can trigger it at will, and doctor just has to just review and give a go ahead. Okay, something is being
Yeah.
missed, add, delete. That's it.
So it's an enhancement. Technology is basically
And
an
sepsis,
enhancement.
as I said, it's a time sensitive stuff.
Yeah.
So these just a couple of examples, a little too
True.
technical, I believe.
Okay.
But what I really mean to say is that technology is going to assist the healthcare services to a greater extent. They can't replace, because there is always a human judgment, as I call it HIL, human in the loop.
Okay.
That cannot be replaced, but the human in the loop has to be there.
Mm.
But the pre-work and post-work can be done by these automation to a greater extent. And these are automation, not AI, by the
True,
way.
true. Right.
Right.
Okay.
AI will be more personalized when we come to, okay, this patient. So in Apollo's also we have something called as an Ask Apollo. It's an AI engine.
Ah, yes, yes.
It uses the 40 years of clinical excellence of Apollo's data at the back end,
Mm-hmm.
and patients all health information which is stored in the application, or they can
Okay.
upload.
Right.
Now you can ask anything,
Mm-hmm.
and it will give you personalized information.
Oh,
You
interesting.
take a picture of a medicine and upload it in the Ask Apollo chatbot.
Chatbot, right.
You can ask anything about it. Is this medication safe for me?
The
What is
side
the
effects.
side effects and all
Right.
those things?
Okay.
And you can say, okay, I'm a diabetic. You know, how what is the dose adjustment I need to do?
Right.
Those kind of stuff.
Okay.
So that is what clinical grade AI is all about now.
Saves a lot of time. Really informative.
Very informative.
Very
I think this is
informative.
something everybody must use,
Right.
and we have seen the accuracy and precision quite good, right?
How long did it take to develop this
It's
system?
been 4 or 5 years in practice now, and still
Okay.
every now and then new things
Yeah.
comes across. But yes, it's been a quite excellent and diligent, deep work being done by a lot of people
Right.
at the back end, and now it's in the shape wherein actually we can use it to a greater extent. Must try it. Everybody must try it.
Do any other ecosystems other than Apollo have something like this?
See, the Apollo's advantage is the clinical knowledge repository goes more than 4 decades.
Okay.
For
Right.
anybody to have it, right, need to have that kind of a time span,
Right.
right? Anybody to, so it's not, the technology cannot be done by anybody else.
Right.
Technology is there, right? The only thing is access to that information, right?
Yeah.
The longer you are into the healthcare span, the access and the quantum of information would be higher, which will give you more precise outcomes. Now, Apollo is one of the most trusted healthcare organization there for more than 4 decades. I've been part of the hospital and the digital ecosystem.
Right.
So I've seen Apollo from a inward out and outward in point of view, while I've been part of the competition also.
Right.
A beautiful organization. One thing with Apollo, we used to call it a family, and it is a family,
Right.
right? So it's not a typical promoter driven organization. There is something, a binding force to Apollo, and that's the reason you will find a lot of people who work for ages for Apollo,
Right.
right? And at the same time, they are the helm of best of innovations. They are the first one to bring all the new age, cutting edge technology to the world, to the Indian ecosystem. And the quality, patient centricity, I believe is tremendous.
Right.
So that's the reason this is my third time in Apollo.
Oh yes, you did start it off with
Yeah,
Apollo.
I started with Apollo. I had an Apollo interface. Now I'm back to Apollo.
Beautiful.
And people do value what you do. And that may be one of the reasons I've actually come back, not only for my own inner self, it's also for my employer to look at.
True.
So that's it.
So, what opportunities do you think young healthcare professionals have today, which you did not have back when you started?
So when I started, the technology was minimal. AI is not there.
True.
Right? I think today's youth are a little more informed, but they need to be aware of very clearly the skill set required to execute your job. Right? If I was doing the clinical audit in the very beginning, definitely I didn't have the tools to do so.
Right.
Right? I was doing things on Excel's kind of a thing. If somebody is getting into a healthcare ecosystem domain as let's say finance guy, right? So they have access to all those tools which has healthcare predominant information pre-read available,
Right.
so that they can make their decision making quite simple and So what I would urge everyone to assess their roles and try to figure out what all tools and information available in the market as a free access or maybe as a domain access, right? Do get your skills sharpened way before they are required.
Right. For a young or for a doctor watching this episode, wants to shift his career beyond the clinical practice, where should they begin?
See, I would urge, you should first listen to your intern calling, because I don't want to shift doctors to because we need
We need
doctors,
more doctors.
right?
Yeah.
So, but yes, as a doctor, you should embrace technology, right? I do see a lot of people who have a friction with the technology adoption. And
Right.
if you don't adopt, probably you'll not be able to reap the benefits they are actually providing you. The example
True.
I just said,
Yeah.
right? If you're not open to that conversation being heard by AI and getting you the, a lot of people I do come across, ye kya batayega mujhe, summary diya hai
Exactly.
and all those things, should not get to that domain, but you should embrace the technology and the change which is happening in the world. So people who are into the core clinical domain should definitely get their clinical domain expertise sharpened. Technology can help you to deliver it better,
Right.
to give you the pre-information you require, at the same time also to sharpen or improve your clinical information skills, whatever
Right.
access to journals and all those things. I can
True.
actually summarize you, give you
Yeah.
handful of information,
Right.
rather than going through searching through the databases of sorts. So that is something as a young doctor, practicing doctor, you should look at. If you are from a clinical domain or even from a non-clinical domain trying to work in a clinical support domain,
Right.
I think you must understand what the healthcare technology is all about, innovation is all about. A lot of things happening around,
Right.
and you should understand the healthcare space, the illness space and the wellness
Wellness
space.
space. Okay.
Right.
You put it very well.
Yeah.
Right. You've come a long way since you've started in this journey. So, what do you think is the price of ambition nobody talks about?
A very well articulated question. I would say the price of ambition. I would
Ambition.
put it that way. See, you have to do a lot of hard work to get it done, and when you do that stuff, probably you also have to look at your family and your personal
Right.
compromises to a greater extent,
Right.
right? You have to do that balance, and during this, what should say, hard fought run race, right? Sometimes things can tend to, park behind.
Right.
Be mindful of that,
True.
right? Don't compromise on your personal aspects. We always talk about the work-life balance, which is not always the case,
True.
right? So, yes, those things will come. You might have to compromise a bit at certain point of time. Not don't make it a habit,
Right.
right? One and off is enough, but you should know what is enough, what is not,
Exactly.
and that is something, a price everybody has to pay to certain extent. But you should find a way to make amends for that.
True. True. So, what is that one failure in your career that you're grateful that it happened?
The way you articulate the questions are
These
quite
are our
interesting.
signature beyond the title questions. Like we've gone through your professional career, stories, experiences. So these questions help us understand what's the journey that brought you here.
See, I told about my journey, right? And every new thing which I did, it emerges from either a challenge, or if I have to call it as a failure, it's a failure, right? When I was in consulting domain, understanding the financial acumen was something I would say I should have worked before getting into the domain, right? Which eventually I learned, right? That's one. Even entering into a startup ecosystem, the process excellence part is something I can actually predate,
Right.
right? Because you will get exposed to those things to a larger in a hospital, this life is slightly slow. In a startup, is super fast.
True.
Right? Whenever you transform your journey from one ecosystem to another ecosystem, I think you must pre-learn the challenges you're going to face.
True.
If you know that, probably you can be better prepared and excel even further.
Right. In this season of life, what are you learning and what are you unlearning about yourself?
Learnings always start with unlearning, by the way. Right? So, as I said, learning is all about, as I said, which is currently in my domain, is on the board level stuff,
Right.
which is I'm trying to sharpen my skills for, and which also gives you a lot of learning experience around the way people interpret the annual reports, strategy reports, and the financial reports,
Right.
which is not natural to me being a doctor.
True.
Right? So this is something I'm learning to a greater extent, and that gives me an unlearning of the current financial understanding, which is of no use.
Right.
Right? You really have to revamp the whole stuff, and even the strategy bit is also evolving. right?
Right.
So board is all about strategy, looking beyond the current business,
Right.
how the business can actually scale up while being, conscious of the society and mindful of the, profits.
Right.
That is how you should
Okay.
actually look at. And one more aspect which is in my radar is yet to be learned is the ESG part,
Okay.
right? So this is again, I think every leader must know, learn, understand, and implement.
Right.
I've been trying to figure out the first basics of ESGs.
Right.
What are the environmental safety goals? Whatever you're doing in the organizations, what is the net neutrality of the same? Is
Right.
it impacting an ecological disbalance? Can I still do my business while ensuring the nature and the ecosystem is in the safe
Right.
hands? So that's something I have yet to be taken.
Right. What keeps you grounded as a person?
My wife.
Oh, wow.
It's a very straight answer.
Okay, how does she do it?
I'm sure she has a wins
Uh,
and fancies, but anyway, I think a lot of it to be given to my wife and my family, not only and not taking away from my parents,
right.
right? Another part which I try to practice is be maybe 5-10 minutes a day spent to the spirituality.
Right.
So my family has been since long associated with spirituality, not religionship, the
Right. Right.
spirituality part of it. Uh, what I do practice, I don't have any gurus or kind of a thing, and there is no, association of spirituality because of a catastrophe which has happened.
True. True.
It's just a regular regime,
Okay.
right? So you
Right.
take that 5-10 minutes of yours, focus on whatever you want to from a spiritual domain perspective.
Right.
So I think that is something, it gives you more inner peace to some extent. That's what I felt, and that's the reason I keep on continuing those things.
Right.
Do while I drive away to my office, I just, switch on those things if there is no call or something, right? Visiting daily temple and just sitting there for
Right.
5 minutes. It helps. That's what I felt.
Okay. Beautiful. So, if titles, your profession, everything disappears tomorrow, what part of you would still remain?
I think the network,
Mm.
the society, and the circle we have created,
Right.
it's beyond titles. I have not earned or I've not got those friends, be it my subordinates or my peers, colleagues, or seniors, just
Right.
because of my titles. So I believe there are few close associations, which goes beyond that. And if everything disappears, these people will remain, and these are assets.
Wow. Great. Let's do a quick rapid fire.
Yeah,
One book every leader should read.
there's a book called Deep Work, right? Again, a bit of background of it.
Right.
1MG has this tradition of gifting books to the leadership every new year,
Right.
right? I'm not an avid book reader.
Okay.
Even medical books, I was trying to do whatever the fast I can do,
Right.
right? So that is where it gave me some access to the books, and this is the first book I got it when I was in 1MG,
Okay.
way back in 2019,
Okay.
right? And it's a fascinating book. It really gives you to look deeper into whatever you're doing and try to figure out the best way possible out.
Right.
So it's a really interesting book.
Beautiful. One habit that changed your life.
I think having that 5 to 10 minutes of spiritual conversation in yourself, it's
Right.
something really helps,
Right.
and it really changed the way I do
Beautifully.
workout.
Awesome. One risk you're glad you took.
Joining a startup,
Must be a huge shift from
it
a
was
bigger.
it was it was. In fact, there was inner conflict because startups, they are not you know financially stable,
True. True.
so to called, right? At the same time, give you a lot of exposure to
A
the
lot of
learnings,
learning. Right.
right? So I think that's a big risk which I took and paid off beautifully.
Okay. One healthcare myth that people should stop believing in.
Healthcare is all about treating diseases. It's preventing diseases.
What is success for you in one word?
Happiness.
We did speak about your wife a lot, how she has been the driving force behind your career or journey. So, can we talk about that? How important it is? Usually, we see doctors getting married to doctors. They say they understand each other better. So, How has this worked
So
out for
my
you?
wife is an Ayurveda practitioner.
Oh,
Okay,
beautiful.
she comes from a healthcare background and Ayurveda and traditional medicine is part of it,
Right.
right? And she also a good investor. She does stocks and all those
Oh,
things.
lovely.
So you can understand her, thinking process, which is cross domain,
Right.
right? The good thing is, uh, maybe we are the best friends, so we interact and share a lot, and don't hesitate to even
Right.
point out without getting selflessly unmotivated towards
Right.
that stuff. So that's how it's been a beautiful relationship.
Would you like it, or would you encourage your kids to get into healthcare?
No,
No?
I don't encourage. I
Right.
leave it to them. I give them the insights what they need or desire. Right.
Right.
Just to tell you, my daughter, she's in just entered 11th, and she has
Okay.
took commerce and maths.
Okay.
Right. I left it to her. What you want and access to information, I'll give you. And right now, by the way, kids don't have lack of information access. They
Oh,
are actually
yes.
overwhelmed.
True.
So ask me, I'll guide you. I'll guide you if even if you don't ask, but I'll not push you. That's how we have
Right.
kept it that way. Both
True.
me and my wife.
If not for a healthcare professional, what would you have become?
Maybe a cricketer.
It has been a beautiful conversation with you, Dr. Lalit.
Pleasure is mine.
Thank you for your time and thank you for all the valuable insights that you've given us today. We wish you
I
all the very best in all your future endeavors.
thank you. I actually
Thank
love
you.
this conversation a lot.
Thank
And
you.
sometimes these conversation also scratches the surface of your inner self, which you
Yeah,
have been
make you
hidden for
look
some time.
inward. Yeah. I think it's very important for all of us in our busy lives to actually take a step back and look
Correct.
behind how far we've come in life.
Truly,
So,
and you've
and you
done
sure did
absolutely.
come a long way. So,
I still feel it's a long way to go.
yeah,
Yeah,
that's a
it's not
never
done.
ending thing. So,
Correct.
yeah. But it was lovely talking to you. Thank you
Pleasure
for
is mine.
coming.
Thank you.
Yeah. So, that's Dr. Lalit with us today. And we'll get back to you in the next episode of Beyond the Title.
Thank you.
Thank you.